Hi, I'm Rachel, a nursing student at Heartland Healthcare Center. I will be presenting a patient to you. Patient is a 77-year-old married Caucasian male. His former job was as a computer analyst. He also is a veteran. Patient was transferred from the Ann Arbor VA Hospital to Heartland Healthcare Center to watch over his healing and continued care as his multiple sclerosis continues to progress. Information had to be obtained from his charts and wife due to progressing dementia. Patient's chief complaint is multiple sclerosis and post-traumatic stress disorder. Patient was diagnosed with multiple sclerosis at age 30, states that heat and sun exposure are aggravating factors. The only alleviating factor is medication. The multiple sclerosis has been progressively worsening since the diagnosis. He states that he is losing more feeling and the ability to do activities. The only effort to treat is through medication. Patient states that there are major interferences with activities of daily living, such as inability to walk, feed himself, or move around without assistance. Patient has accepted that he will be getting progressively worse very quickly and there's not much that can be done. Major symptoms, as stated by patient, are inability to move, reduced sensation, and recurrent amnesia. Patient was diagnosed with post-traumatic stress disorder and senile psychosis after his return from the war. States that the only aggravating factor is discussion of war. Alleviating factors consist of multiple medications. Patient states that there is progress due to his medications. The only interference with activities of daily living is occasional anxiety. Patient states that he no longer perceives this as a problem due to medication treatment. Blood pressure, 115/58. Respiratory rate, 20 breaths per minute. Temperature, 97.3 degrees Fahrenheit taken orally. Pulse ox, 85%. Pulse, 82 beats per minute. Patient has a history of hypertension, recurrent UTI, dementia, osteoarthritis, Parkinson's disease, hearing loss, diastolic congestive heart failure, orthopnea, type 2 diabetes, depression, and high cholesterol. Patient has had multiple pressure ulcers due to a seating deformity that causes constant pressure on the right hip. As of February 11, 2015, patient had a stage 4 pressure ulcer on the right hip. Wife states that immunizations are up to date. Patient and wife state there are no allergies, but chart states an allergy to codeine. Past hospitalizations and surgeries consist of an incident of sepsis with septic shock, multiple surgeries following a motor vehicle accident, and right ankle surgery. Patient medications obtained from charts include amantadine, HCl 100 mg capsule by mouth every 12 hours for Parkinson's disease, 2 baclofen 20 mg tablets by mouth every 12 hours for muscle spasms, 1 dalfampridine 10 mg 2-hour extended release tablet by mouth every 12 hours for multiple sclerosis, 1 metformin HCl 500 mg tablet by mouth 2 times a day for type 2 diabetes, 1 pisperidone 0.25 mg tablet by mouth 1 time a day for senile psychosis, 2 sertraline HCl 100 mg tablets by mouth 1 time a day for depression, along with multiple other medications for high cholesterol, UTI treatment, BPH, GERD, wound healing, and various dietary supplements. Functional assessment. Patient reports a history of heavy smoking, but has quit recently. Patient reports no alcohol, drug, or caffeine use. Patient gets exercise only through therapy due to his limited movement related to multiple sclerosis. Patient reports normal and consistent sleep patterns and naps daily. Charts report poor nutrition due to the inability to feed himself. Charts also report a carb-controlled diet. Supplements are used to aid nutrition. Patient uses a wheelchair for transportation, hearing aids for hearing loss, and glasses for decreased vision. Psychosocial. Patient currently lives in the facility but is visited every other day by his wife. Patient states that his family is his main support. Patient has 2 sons and 8 grandchildren. Patient denies symptoms of depression but is on multiple medications for depression and senile psychosis. Patient is a war veteran but refuses to discuss the war as a stressor. He also denies any environmental hazards. Patient enjoys television shows and visiting with his wife. He refused to discuss spiritual and cultural practices. Completed a high school degree but did not attend college. He states that his job as a computer analyst required only specific training programs. Patient states that he does not have a specific healthcare provider and depends solely on the VA and Heartland to supply care. Patient charts state behavioral problems related to women caretakers. Family history. Patient could not recall family history, so his wife supplied information. Wife stated no history of health problems. Neurological. Given patient's diagnosis of dementia, Parkinson's disease, and post-traumatic stress disorder, it is important to check his neurological status often. Patient denies injury to the head or neck, changes in gait, taste, and smell, falling in the last 6 months, or exposure to toxic chemicals. Patient denies symptoms of fainting, dizziness, lightheadedness, seizures, or headaches. Patient states that he does have tremors related to his Parkinson's, memory problems related to dementia, and hearing and vision disturbances. He has difficulties carrying out daily activities of living due to his memory loss. Upon examination, patient is in no distress lying in bed. Patient is a well-groomed male with a small frame. He appears his stated age. Patient is alert and oriented to person, place, and time. Speech is clear and vocabulary is appropriate to age and experience. Attention span normal. Both short and long-term memory not intact. Judgment intact. Motor function examination not possible due to multiple sclerosis. Light touch sensation intact bilaterally throughout the body. Astereogenesis noted. Inability to identify number tested in graphophasia. Musculoskeletal. Given the patient's diagnosis of multiple sclerosis and the progression of it, it is important to assess musculoskeletal function. Patient denies pain or inflammation in joints. Patient reports progressing weakness, decreased mobility, and tremors related to multiple sclerosis and Parkinson's disease. Assistive devices include a wheelchair. Activity can rarely be tolerated. Complete loss of ability to walk and self-feed. Upon physical examination, decreased muscle mass was observed. Full range of motion in the temporomandibular joint, neck, elbows, and wrists. Extremely decreased range of motion in the right finger. No range of motion in left fingers. Unable to test range of motion in lower extremities due to patient being bedbound. Bicep and tricep strength 3 bilaterally. Left wrist and finger strength rated at a 2. Right wrist and hand strength rated at a 1. Lower extremity muscle strength could not be obtained due to patient being bedbound. No edema present. Pertinent system number 1, genitourinary. Patient has a history of recurrent UTI and has one currently. According to an article in the Journal of Antimicrobial Agents, UTI in men causes a co-infected prostate in over 90% of male UTI cases. This causes extreme discomfort both in the case of the UTI and the potentially infected prostate. This makes it very important to assess the genitourinary system because patient already has benign prostate hyperplasia, which contributes to urinary difficulty. Because of patient's history of recurrent UTI, it is important to always be examining for symptoms of emerging UTI to maintain acceptable comfort. Pertinent system number 2, integumentary. As previously mentioned, patient has developed many pressure ulcers due to a seating deformity that places constant pressure on the right hip and makes it almost impossible to offload the area. According to an article in the International Wound Journal, patients with pressure ulcers have a much greater risk for severe infections such as sepsis, which can lead to death. It also discusses the prevalence of pressure ulcers in patients with comorbidities such as multiple sclerosis. This makes integumentary exam extremely essential. By identifying changes in the skin, it is possible to identify a pressure ulcer before it gets to a later stage.